Does it work? Good morning, everyone. Thank you for coming and interesting to our session. Empowerment and engagement, strengthen TB response of communities and civil society organizations through technical support and systematic data collection. The session will highlight the opportunity and outcomes associated with providing short-term technical assistance to address urgent issues, as well as long-term technical assistance that facilitate a comprehensive approach to program planning and outcomes. Our session brings together the great speakers from TB-affected communities representatives, technical providers, and program implementations. And I would like to pass the word Ivan Varintsov, who is the coordinator of regional platform for ICA region, and he will tell us about short-term and technical assistance in the region. Vanya?
Okay, thank you, Vlada. Good morning. Yeah. I will start with providing some background to better set the context of my presentation for you and the context of the technical assistance program I will be talking about. As you may know, the Global Fund implements a number of strategic initiatives. One of them is Community Engagement Strategic Initiative, formerly known as the Community Rights and Gender Strategic Initiative. Currently, it's the third phase coming to an end next month. But good news, it was prolonged for 3 more years, starting from January next year. So this strategic initiative particularly is focused on strengthening the meaningful engagement of civil society and communities, including TB-affected communities, into the Global Fund-related processes at the national level. This initiative consists of 3 components. The component 1 is Community Engagement Technical Assistance Program, about which we will talk more during the presentation. The second component, which we will not cover, it's the long-term capacity strengthening of HIV, TB, and malaria networks and organizations. And the third component, it's like the work of 6 regional communication and coordination platforms. And actually, my organization, the Eurasian Harm Reduction Association, which is being based in Vilnius in Lithuania, we since 2017 we host the ICA regional platform. One of our objectives is to improve the access of community to technical assistance, including through the component 1 of the strategic initiative, through this community engagement technical assistance program. So now 2 more slides about this community engagement technical assistance program, and please consider this as well as an advertisement of this program, because unfortunately it's not much being used by the TB-affected communities, at least in ICA region. So who can apply for technical assistance available from the Global Fund within this program? So it's key population networks, youth-led networks, women's networks and organizations, networks or organizations of people living with AIDS or affected by TB and malaria, civil society networks and organizations led by or working with other affected. So generally everyone related to civil society, communities, and Global Fund processes in their countries. So who provides TA? There is a list of pre-selected 27 organizations pre-selected by the Global Fund who provide technical assistance. So they have different focus areas. Some of them have specific focus on TB related issues. And this list was recently actually updated in advance to the start of the implementation of the new phase. So what type of TA can be requested? First of all, it's situation analysis and needs assessment, engagement and country dialogue related processes. Country dialogue is the process mostly about like the development of the new Global Funds, new proposals for the Global Fund grants from the countries, and supporting design and implementation arrangements of the Global Fund grants. So what cannot be supported? Yes, CCM strengthening, long-term capacity development of NGOs, development of standalone tools that lack a focus on community engagement, and Global Fund finding requests writing. So, as I told, like one of the roles of Eco Platform is to promote this technical assistance program among communities and civil society, including TB affected communities in the region, to make sure that they know about this program, they use this program, and they submit their proposals and they receive this technical assistance. So this is a snapshot of what was done by us as a platform during the current phase of the implementation of strategic initiatives, starting from 2021. So we conducted 9 webinars specifically about this TA program, covering more than about 200 people, disseminated information through different regional thematic listservs, social networks. We subcontracted national focal points from among civil society, from among communities, to promote the program on the national level and to help civil society and communities to better understand their needs and draft the requests. And actually this is one of the most effective approaches to initiate requests for technical assistance. So we constantly provide information about TA program to the CCMs, so CCM members can then disseminate this information among their communities. We document successful case studies of TA provision. We organize a regional forum to understand and to discuss the progress with the implementation of this TA program in the region. Promote TA program through the websites, etc., etc. And of course, we cooperate and collaborate with regional key population networks like TB Europe Coalition, ECOMS One, etc., etc. So, because, for example, TB Europe Coalition is the partner within the second component of this strategic initiative, and so they help us to promote also this TA program among TB communities. So what are the results? So within these 3 years, we managed, if to talk only about the Global Fund's community engagement TA program, we managed to initiate 25 requests from 12 countries. 24 of them were supported by the Global Fund. So if to compare within the previous phase, 2018-2020, we managed to initiate 19 requests, but like only 11 were supported. So we doubled the result, like since the last phase, and it's like it's a good result. And of course, we are also trying to promote other TA being available in the region, because there is like support being available from Stop TB Partnership, GIZ, WHO, UNAIDS, if we talk about HIV. So overall, we managed during 3 years to initiate 40 TA requests, of which 35 were supported. But, okay, yeah, here's, 2 minutes, two last slides. So briefly, for you just to understand what actually can be requested and supported. This is an example from 2019 from Tajikistan. So local NGO approached gender and development. The budget of TA support, overall budget, was $50,000 US, which is not bad. Like, so it's a substantial amount of money you can rely on. The provider was Canadian HIV Legal Network. The period of TA provision took a bit more than half a year. The objective was assessing the stigma, gender legal barriers to accessing TB services in Tajikistan. And you can see the list of TA activities being supported. Yeah, desk review, collecting the field data, data analysis, preparation of the assessment report, presentation of the results, and development of action plan. So the full case study is available at the website of the Eco Platform. The last slide. So, but what are the challenges? So, unfortunately, as I said in the beginning, the most TA requests are coming from HIV affected communities. So from the 25 requests we received, only 5 during the current phase, only 5 of the requests were with the focus on TB-related issues. And we struggle with initiating like the requests from TB affected communities. Even it was difficult to find focal points within countries from among TB affected communities to help with the initiation of such requests.
Thank you, Vanya.
Yeah.
Yeah,
Okay,
we
yeah.
have the timing.
Yeah.
We will have opportunity to ask a question at the end of the session. Yeah, thank you.
Yeah.
And I would like to invite Parvana Valieva, who is Executive Director of Azerbaijan NGO, and she will be speak about experience receiving technical short-term technical assistance during C19RM project and Global Fund preparation country proposal. Please, Parvana.
Yes, thank you so much, Vlada. Nice to meet you all. I'm Parvana Valieva, Executive Director of Support to Health NGO that is located and operating in Azerbaijan. We are mainly focused on ex-prisoner TB patients, treatment follow-up project since 2011. And our main beneficiaries are vulnerable populations such as prisoners and ex-prisoners. Today I will present to you about how technical assistance support by the Global Fund played a crucial role in our proposal, in development of a funding proposal to the Global Fund. Community Engagement Strategic Initiative is a support provided by the Global Fund for strengthening civil society organizations and communities' engagement in preparation of funding proposals to Global Fund. And Azerbaijan civil society organizations fighting against TB are very active since Global Fund, the biggest external donor, support our activities in our country in TB response, both in financially and programmatic approach. And Global Fund provides support to TB survivor and key population networks, organizations and groups through Community Engagement Strategic Initiative, and it was supported through TB Europe Coalition in our country 2 times. It was in 2021 for COVID-19 response mechanism proposal development period, and the second one was in the development of civil society priorities for Global Fund Cycle 7 this year. The objectives of CRG COVID-19 response mechanism technical support in 2021 was mainly about ensure and advocate for community and civil society meaningful engagement during full funding support development process. And it was supported by, again, TB Europe Coalition with financially, and it was the big opportunity for us to hire coordinator, consultants to prepare comprehensive proposal, priorities for on behalf of civil society organizations operating in our country as well as community, TB affected communities. And it was provided opportunity for us to lobbying on our priorities during high-level meetings as well as with Global Fund CCM, Global Fund Project Implementation Unit with sub-recipients of this grant as well as the main principal recipient. So with the activities within the project provided us to list, draft our suggestions and conduct consultations with country community, civil society organizations, and we prepared our budget, work plan, as well as priorities to be included to the country funding application. What was the outputs of the technical support? It was provided coordinator, and our coordinator was included in writing team in a working group of country funding proposal. We established good relationship with CCM Secretariat, Chairmanship, as well as with PIU to have more and fruitful communication during the preparation process. And good coordination online communication with civil society organization during the development of civil society organizations suggestions was strengthened. And the second technical assistance support was provided this year related to preparation of country application to the Global Fund Cycle 7. It is again provided as funding for hiring external consultant to figure out our priorities and innovative approach for this cycle. I would like to mention that before this technical assistance, before 2021, it was not systematically to prepare civil society and community suggestions to be included to country application. It was mainly prepared, developed by national TB program. It was not innovative. It was developed, prepared by national consultants, so not so systematic, not so professional. But after this technical assistance, we had opportunity, we had financial support and opportunity to hire professional consultants in order to prepare, develop our priorities, our proposal. And the main outcome in this technical assistance ensured an inclusive dialogue by engaging a broader number of civil society and community representatives, including the region, the community group members operating in the regions as well. And we also invited TB survivors, key population groups to our consultations in order to gather more suggestions to meet their needs, to meet their targets during the next Global Fund cycling process. So it gives us enhanced partnership, participation. We informed decision makers, and it was collaborative approach. Thank you so much for your attention.
Thank you, Parvana, to share your experience, and we're glad that technical assistance was useful. I would like to invite Olga Klimenko, who is TB People Ukraine, and she will share with us lessons learned not just from short-term technical assistance, but and from long-term technical assistance. Ola?
Thank you, Vlada. Good morning, everyone. Thank you for your attention. It's so comfortable area. First and most importantly, I want to express my gratitude to Ivan for general opportunities for all civil society and organization from community for this technical assistance. TBEC team, TB Europe Coalition team and all experts who involved in our assistance in Ukraine, because TB People Ukraine is a national Ukrainian organization. And I also want to thank Yulia Kalancha, Executive Director, TB Europe Coalition, who today with us, and Liliana Karaul, experts from Stop TB Partnership, for advocating for community rights during the preparation of the application itself in Ukraine. Because without this advocating, we haven't any results for communities in Ukraine. The technical assistance process has both pros and cons. Of course, this is an additional resource, primarily an expert one, because the community potential is not always sufficient to prepare such important application, since the Global Fund is still one of key donors for communities in all worlds. Unfortunately, we need more donors. some examples. In slides you can see what intervention was prepared with technical assistance from TB People Ukraine and some budgeters, but I'm comment some results. Ultimately, the results for the community can be assessed as sufficient to sustain the team and activities for the next 3 years. The total budget for the main funding in the application for $1.5 million. But what the community will receive, it about $900,000. In connection with the war, we ourselves optimized our direction and as well understand that it's now critically important to strengthen our healthcare system. So you can see our priority was CLM, some capacity building. We haven't advocacy in next period because before war, our activities, it was, I think, eight way for Ukraine, for community TB People Ukraine. In next 3 years, we will have only 3 areas where will we be work, because we are optimized. But I want to focus on other aspects. For the first time, it was possible for communities to reach a decision by the technical group to the designate community intervention as a pre-selected. This means that there are no competitions for these areas. Organizations are guaranteed to receive this budget for 3 years according to the terms of reference. And this is for all 9 communities that operate in Ukraine. Of course, this is impossible. This is not. I'm sorry. This is impossible without expert support. What I said earlier. From our regional, what needs to change is, of course, the impact of technical assistance on the results. For the Global Fund and CCM, it is really necessary to reconsider the approach to evaluation, intervention, prepare and using technical assistance. The process and efforts lose mean if for country these interventions are at the same level as those that were submitted simply in process. Because for us, this process, advocate, prepare all intervention, it was maybe 6 months. But our interventions was on a one level with the organization who didn't do this work, this prepare work. I think these are really these are all key points that I would like to note, and of course I will be glad to answer if you will have. Thank you for this.
Thank you, Ola, for sharing your experience and lessons learned. And we would like to thank you and TB People Ukraine for their active position for request technical support. I would like to invite Georgi Kuchuhidze from WHO Europe region to provide overview of the 4 new WHO indicators on community engagement, including in the new TB action plan. Georgi.
Thank you. Good morning, everyone. So my presentation is about measuring the meaningful engagement of the community to end TB, to respond to TB. And the presentation is about 4 indicators, the overview of 4 indicators that we recommend countries to use in the WHO European region. A few weeks ago, WHO released the guidance on meaningful community engagement to end TB, which was in response to the UN high-level meeting declaration, calling countries to ensure strong and meaningful engagement of civil society and communities affected by TB in planning, implementation, monitoring and evaluation of the TB response within and beyond the health sector. And the guidance provides the information as well as defines the role of the community and defines the civil society partners, as well as provides the insight how to ensure the meaningful engagement of the communities into TB response. It also provides the key principles, and one of the principles, among others, is that the meaningful engagement must be measured to track the progress. And then the guidance provides the instructions how to measure this progress. There are 4 indicators that are included in the guidance. The first one is about the referrals of people with TB from community health workers and community volunteers. The second one is about assessing the treatment outcomes, successful treatment outcomes among those patients who were supported by community. The third one is looking at the community representation at the national decision making, and I think other colleagues also mentioned the importance of this one. And the fourth indicator is looking at the level of funding which is available for the community engagement activities at the national level. The guidance also includes the checklist for measuring engagement of the community, and the table on the right provides key indicators of community and civil society engagement at the national and subnational level. And there are a number of questions which are quantitative as well as qualitative questions assessing the engagement. So these are the indicators as well as tools that are recommended by WHO to assess the engagement of the community at the national and subnational level. But at the regional level, we also have the new TB action plan for the WHO European region, endorsed by member states last year on the regional committee. It has its vision, goal, I will not list those to save the time, but it also provides some recommendations. What are the interventions that are needed at the regional level for the meaningful engagement of the communities, and it's accompanied by monitoring and evaluation framework, which also includes 4 indicators that are aimed to assess the engagement of community. And these are the 4 indicators. You can look at them later on if you download the document and look at the M&E framework of it. But the first 2 indicators, the first one is looking at the availability of the standards and operational procedures for the civil society organizations in the provision of TB services. The second one is looking at the availability of the procedures of subcontracting mechanisms under the state funds or other relevant funding mechanisms for the civil society organizations. And we know that this is very important for our region, where many countries are transitioning from the donor funding to the national funding for TB programs, and it's really important to ensure that communities are covered through the national TB budgets. And then other 2 indicators, the first one is looking at the proportion of people with TB who are found through active case finding by civil society organizations. And the second one is about the proportion of people with TB who started the treatment and TB treatment and who received some kind of support from the community, from civil society organizations. And these are the 4 indicators, but then we know that there are some issues with collecting information about these indicators, and there are some issues with the quality and completeness of these indicators. And those are collected through the global TB data collection system, but we know that there are some issues. That is why we work very actively with TB Europe Coalition, with our colleagues, and Lesia will present after me the initiative of developing the algorithm for helping the countries in collecting this information and then reporting it to WHO and other partners, and we hope that this will improve the quality as well as completeness of this data. I think this was it. Thank you very much for your attention.
Thank you, Georgi. I would like to invite Lesia Tankanok, Program Manager TB Europe Coalition, and she will provide us information about the algorithm developed for data collection for WHO Europe indicator within long-term technical assistance. Please, Lesa.
Okay, well, hello colleagues. Thank you, Georgi, for the an introduction for my session, and we actually value the collaboration with the WHO Regional Office for Europe. Today I'm going to speak about the two interrelated things: the algorithm and the data collection. The TB Europe Coalition, in joint collaboration with WHO, developed the algorithm on the 4 indicators to measure the level of engagement of civil society and community. The algorithm was developed actually to structure the overall process of data collection, to clearly describe the indicators and the way they are measured or calculated, and as well as to strengthen community and CSO in implementing the mechanism of systematic data collection. And so actually the systematic data collection mechanism is a key factor in improving the efficiency of TB response measures led by communities and CSOs for timely adoption of the essential managerial decisions at the country level. It is also important, the algorithm actually is also essential and important for ensuring sustainability of the national programs in transition from donor to internal funding sources, as well as integrating approaches in non-medical service delivery in compliance with the standardized package of community-based support services. Implementing comprehensive people-focused models, TB models, and systematic approach in medical, social, and psychological care provision, and implementing quality interventions in compliance or aligning with the international standards. So in order to conduct the data collection, it's important to know the stages of this process as well as the timelines. So first of all, it is important to start planning for data collection on these 4 indicators at the country level. This process essentially starts in December of the ongoing year, then data collection itself. Starting in January of the year following the reporting year, then data verification at the NTP level, that is the February of the year following the reporting year, then the calculation of indicators 3 and 4, as these are the quantitative indicators. This is March. Then data submission to WHO, which is March, April of the year following the reporting year, and data finalization and publication by the WHO, which is quarter 2 or 4 of the year following the reporting year. So as we have already mentioned, indicators 1 and 2 are qualitative indicators, while indicators 3 and 4 are quantitative indicators that can be calculated and measured. So speaking about indicators 1 and 2, NTPs and NTP and CSOs communities collect relevant data based on the analysis of the country's existing legal framework on the involvement of CSOs and communities. So it is important to say that these indicators are scored, and they are scored. Actually, you put a score to the to these indicators depending on the analysis and on the results of the analysis you received of the existing legislation in your country. So it is desirable that such a joint decision on the assessment score should be recorded in the minutes of the general meeting of all stakeholders. So the meeting is initiated by the NTP or by the Global Fund principal recipients or other organizations that provide financial support to CSOs or community implementing TB projects in the country, and the deadline is not later than the 31st of January. Speaking about indicators 3 and 4, which are quantitative indicators that should be calculated. So in the first 10 days of January, the year following the reporting year, so the NTP sends a request to present data on these indicators. And actually the data is collected and then submitted to the NTP to verify these data. The data submission to the NTP should be not later than the 31st of January of the year following the reporting year. TBAC, TBAC has conducted the pilot on data collection in the 3 countries of the EECA region, and these are Ukraine, Kyrgyzstan, and Kazakhstan. It should be noted that currently the WHO Global Database doesn't contain a separate section for submitting data on indicators 1 and 2, though it is strongly recommended that the NTPs of the countries work on these indicators and send the information to WHO office. Of course, while implementing the project and while collecting data, our project team encountered some challenges which we, of course, tried to tackle and to find rational solutions for. Actually, the main problem is that most health facilities do not keep records if a person with TB was identified with the help of CSO, and that is the existing gap, actually. The suggestions for solving this challenge are that the country's electronic health records should include the information and record that it was exactly the CSO or community who brought the patient to the system, who brought a person with TB, to the system, as well as it is also good to incorporate the new WHO indicators into country monitoring and evaluation plans. Actually, all these processes, as well as the timelines for data collection, are reflected in the guide developed by TB Europe Coalition. The data collection pilot resulted in some success story in Kyrgyzstan. So actually they managed to include a separate section into the electronic TB register, and now they actually can get the information whether the person was brought by CSO or by the community. So thank you for your attention. This is actually all.
Thank you, Lesia. Thank you for such interesting presentation and work that TB Europe Coalition does. We have our session questions. Do you have any questions, guys? No? Maybe you just think about your questions. I will have one question to Ivan. You told that one problem that you don't have enough requests from communities, yeah? How do you think, how we can stimulate communities to apply for technical assistance short term?
Yeah, thank you, Vlada. Just want to start with mentioning that for the next phase, we will have a specific KPI for the platform in terms of the number of the requests being submitted from TB communities, initiated by TB communities and supported by TB communities. So now we will be more kind of focused on the requests coming from, with the focus on TB related issues, and we'll be aiming to increase the number of requests to be supported, and the number of cases being taking place in the region. Actually, we hope that we will have cooperation and collaboration with you, with local TB community-based organizations in countries like TB people, for example, in Ukraine, because we have a very positive experience with Oля, for example, in initiating such requests from Ukraine. And so we will become more focused on communication collaboration with such organizations in countries. And but of course we'll rely on you in advising us whom we can approach, and because you also know better the needs to be addressed with such TA. So we looking forward for cooperation with you.
Thank you, Ivan. Yeah, I see that Ola will be. Yes, okay.
When you spoke, I think in Ivan, maybe after our experience, what we can do, because communities or organization sometimes can find some new ideas for their application, and maybe in this process you can thinking about prepare some brochure with good experience and some areas what can what in country was supposed for another organization, and share this with countries CCMs. We can translate it on national language, and maybe it will be more understanding for organization what is about technical support and what can be prepared for in this process, in some idea. Thank you.
Thank you, Ola. Maybe we have any question from the you? Okay.
Thank you, Vlada.
No, it's
This one?
yeah. Just close.
Okay, just closer. Okay. I will have a question for Parvana and Oля, and maybe Ivan and Lesia can complement. We all see that currently communities are involved already at the stage of preparation of the grant of the grant and the proposal writing. We have the annex for community priorities. However, if in some countries it is still possible to have a bit of community involvement in the process of review of the TRP comments, there is still lack probably of involvement of communities during the grant making process. In the perspective of civil society and communities, Parvana and Ola, maybe you may say how the communities, it is important for the communities to be involved in these processes, and how you see the involvement. And maybe Lesia, as a TA provider, can tell us a bit how this can be done on behalf of the TA providers, and which support can be from the regional platforms. Ivan, thank you.
Thank you. The working? Thank you for the question, Christina. Yes, I think there is a lack in communication between a global fund and civil society organization during technical review process, because we as a CCM members endorse the country proposal with our signatures, who member to CCM, and then this country proposal submitted to the global fund. However, there is miscommunication here because the global fund communicate directly with principal recipient and sub-recipients, and we are not on copy of this communication correspondence. I mean, so we don't know what are their comments to our activities that submitted with together with the country proposal, and in the end we see that some activities submitted by communities missed and maybe removed, maybe not, they see not relevant and they remove it. But we see it in the end. We don't have any opportunity during technical review process to advocate about our activities, to how to say, to make them to believe that it is important, it is our needs, and here we need more lobbying, more advocacy and we need definitely improve our communication. I mean, CSOs, communities, and communication with global fund directly without any intervention, without any intervention of, main principal recipient or sub-recipients, and we need to directly advocate on our activities with the global fund. It is a, lack.
Thank you, Parvana.
Thank you, Christina, for your question. I'm not sure that I can completely answer for this question because it's not easy process, and sometimes in a country level it's not clear process and not clean process can be. And I think we can see on this area from three parts. Firstly, it's about community and civil society. Every time we need pushed and capacity building our experts and be strong advocate. This is possible if we have strong leaders, and it is really possible if communities have money, have funding for all of this work. Because every leaders lost their motivation if they haven't any support from national level or donors. And we have many examples for in the world when organization are down without funding. So it's a first, because community can speak. We only want money. Community must knowing for what they want money, why they need this money, and have possibility advocated in dialogue with ministry there, with CCM there about this priority. Next area, I think it's CCM mechanism. How we can show results of CCM review. In our regional, ICA regional, we haven't good results with CCM, actually with CCM mechanism. We need thinking about this, because if CCM mechanism doesn't work well, we need change something in this mechanism. Because CCM, it's a mechanism who must support civil society and communities in this process. But sometimes it's not our reality. And second floor, it's donors, political from donors. What I said in my presentation, if technical assistants haven't any influence on the national process, it doesn't matter for us. We not interested in use this possibility if we understand that without this possibility, it will be the same process for us. And Global Fund, I think, team of Global Fund, and maybe Ivan, your organization too, must thinking how have some dialogue with CCMs about criteria for technical assistant process. And maybe if on a national level will be some rules about, or if this application was prepared with technical assistance, in startly this intervention will have some 10 balls plus, or something else. And if 3 areas will be completed and work in partnership, I think the general results will be more better for all organizations. Thank you, if I answer for your question.
Yeah. Leslie.
So thank you for the question. And as a service provider, as a technical assistance service provider, okay, Is
Yeah,
that better?
better, yeah.
I'll try. Okay, sorry for that. So I'd like to comment on what my colleagues have just told. So as a technical assistance service provider, our role is not just to strengthen the capacity of the community and civil society representatives, but also to help them build the dialogue well, among all the participants of the process, actually, and among all the stakeholders, to make their voice heard everywhere at all the stages, from the initial stage to its final stage, just to show their meaningful engagement.
Yeah, thank you. Yeah, I absolutely do agree that the grant making stage is one of the most challenging stages in terms of ensuring the meaningful engagement of communities into the process. It's kind of the most closest stage. And I think like this actually short-term technical assistance provided by the Global Fund could be really instrumental here, because actually the request could be from civil society, from communities, could be focused particularly on the engagement at this stage. So they can request the support to ensure, to help them to be engaged, to ensure their meaningful engagement, and at the grant making stage. And from what I see from the requests being submitted, most of the requests, they kind of focused on the support till the moment the request is being submitted to the Global Fund. They do not still include any support covering the next stage. So on one hand, it's a question to the civil society and communities as well, why they don't, if they feel they need some, like, if they struggle there, why they don't include this stage into the request for TA. On the other hand, maybe it's also something for us to work on to better inform people that they can do it and they must do it, and help them to properly formulate like their needs and how to address them. And responding to Ole's question regarding the how to make sure that like the results of the support are being taken into account by CCM, my response will be through the portfolio manager, to make sure that portfolio manager, the country portfolio manager, is aware from the beginning of about this technical support. He or she knows about the content, approves, and she or he believes that like it's something worth to be doing. And like if you have the support of FPM, then it will be much more easier to communicate with CCM and persuade them that like this is not some standalone initiative, but it's actually was agreed on the level of the Global Fund Secretariat and supported.
Thank you, Ivan. Thank you to our speakers. Thank you for your attention. The discussion was great. And we see that with all the technical assistance and other initiatives, we can drive the TB response. And we can just remember that communities and civil society organization should be involved in all stages, and it will be, and we can and TB together. Yeah? Thank you. Thank you. Yes, we can.